Located in Pittsburgh, Juste and Frichtel Dental Labs work on the cutting edge of cosmetic dentistry, creating some of the most outstanding cosmetic and restorative options in dentistry today. Sven, Jesse, and Mark Frichtel lead a skilled staff of technicians working to give you the smile you want and deserve. More than 700 dentists and their patients across the United States trust Juste and Frichtel, your full-service dental lab.
I would say that our mission is definitely to provide our doctors and their patients with multiple options. Each one of these cases are like snowflakes. No two are ever going to be the same. So we have to take in the economic issues, the clinical issues, to provide the doctor with a list of options they can provide their patient to see how they want to go ahead and proceed. We follow that up with, of course, using the latest technology here in the lab to make these cases go in without basically a hitch, reducing the doctor's chair time and the patient's time in the chair, which nobody likes.
After years of struggling with dentures, Claude missed the look, feel, and function of his natural teeth.
And when you would talk, they would come loose and you would back away, lost your confidence. When you ate, anything beyond a soft diet, practically, they would come loose. And this type of discomfort and embarrassment and a lack of confidence got me to a point where I figured something had to be done.
Claude opted for a dental implant procedure, which can easily, comfortably, and permanently replace teeth with no metal in 1 hour. Claude's implants were crafted by the talented experts with Juste and Frichtel Dental Labs. By using the latest cutting-edge technology, Juste and Frichtel create implants that give the aesthetics, function, and feel of natural teeth.
But we are a full-service lab. We provide partials, dentures, crowns, bridges, inlays, onlays, cosmetic restorations, just about anything that any patient would need. Our niche is dental implants. We use the latest CAD/CAM technology combined with the latest materials such as zirconia to provide our doctors and their patients with cutting-edge options that are not done anywhere else in the world.
We now could do a CT scan of a patient, knowing his bone structure, creating a computer-generated stent from that, what the surgeon would use to place the patient's implants. These implants will be placed and restoration will be manufactured parallel to that to go in on the same day. So the average is about 3 to 4 hours, depending on the amount of implants, and the patient walks out with fully functionable teeth in that morning.
CAD/CAM is the greatest thing that's happened to dentistry. Basically what it does is it utilizes scanning and computer-aided manufacturing to create a substructure that will provide a fit better than human hands can do. Now with the ability to use CAD/CAM, it allows us to use 2 new materials. One is zirconia, which is metal-free. The other is titanium. Both are extremely biocompatible, and they both have no issues with the fit of the case. They're completely passive, and we can worry about just building on top of the substructure instead of worrying about the substructure itself.
Dental implants have absolutely afforded patients a new opportunity, a refound nature to their missing natural teeth. It's given the chance for that person to function in their entirety with complete confidence in both chewing and speech. In Claude's case, we placed 8 implants, surgically placed the 8 implants in 1 day, and we're able to, because of the proper jaw dimensions and proper planning to the surgery, we're able to add the fixed partial denture for him in 7 days.
I'm a different person, really. I'm able to smile with confidence. I'm able to be in front of people, to speak to people. You relax when you go out to eat, you enjoy your meals, and you enjoy the people you're with. So the benefits are tremendous.
New, fully functioning teeth are easier than ever to achieve. And to help get the smile you deserve, trust Juste and Frichtel Dental Labs, where quality and consistency come together for you.
When you've taken a patient that's had dentures in their mouth and provided them with a fixed option that looks cosmetically perfect for them, there's no better feeling in the world. We have had phone calls from patients just crying because they did not believe that they would ever look like that again.
We are involved with a lot of alpha and beta tests, and it gives us the freedom to try new things. So where the industry is not thinking about yet, we could already try and implement into patients. These restorations are not done normally. but it will give some patients with a special need an alternative what they did not have prior to it.
This is a telescopic restoration. This is one of the #1 restorations done in Europe, and the reason being is that if natural teeth happen to fall out, we can just fill them up and the case is workable again. These types of restorations will not go bad. They can work in the mouth with just one tooth left. And the way they stay on is through friction. You put this on, it goes down, and it'll hold in place, and it pulls up just through friction.
Juste and Frichtel may be one of the most sophisticated and capable laboratories in the country, if not the world. Sven, Juste, the lead ceramist that I deal with directly on these cases, has trained worldwide and has trained ceramists and other dentists worldwide. He brings a wealth of information to be able to draw from all areas of the world and the country on implant technology and fabrication, and again, makes us the hero of what we do. Patients contemplating dental implants should feel very comfortable in the opportunity to have dental implants placed. We have the capability of placing a single tooth implant or multiple implants, as we see in Claude's case. We can place them and restore them in an hour in a process called immediate load. That affords the working professional a tremendous advantage. It also gives the patient an advantage in recovery time. You have immediate function, immediate aesthetics with immediate gratification.
It wasn't as difficult as anybody would think it is, and it's because of Dr. Narcisi and his staff that the process went so well, and I would certainly recommend Dr. Narcisi and his staff and the procedure to anybody.
We had an article published back in 2003 on a cutting-edge option that we basically designed. The doctor called us up, said I had this case sitting on my desk for 3 years with no idea how to handle it. In one stroke, you guys gave me the best option ever that I could offer. And we did the case, they completed it, the patient was extremely happy. Over here we have cases that are coming in from our labs in Asia. We actually have a doctor here that does quality control on all these cases to make sure that the doctor's prescriptions are followed and met. Now on this side, we're getting cases ready to be shipped out to our labs. We make sure that we read the doctor's prescriptions, create work tickets, and again get them packed up so nothing will happen to them in the flight over. UPS did a case study on our international division, focusing on the time it takes us to get the cases over there and back. This case study focused on a bride that needed to have her veneers done before her wedding, and we were able to make it happen. One of the things that we use here for bringing people into the lab to train is a J1 visa, which is an education visa. We find people in mostly Europe that have the same basic training as my partner Sven, and we bring them over here and we teach them how to work on these large implant cases. In our lab, they will see more implant cases in a week than they would in 3 years probably in the lab they're in Germany. So they get a very fast education on how to deal with these types of cases.
In the future, I will see us more leaning into the technology. As prior to it, everything was done by hand. It was very individualized for each patient. It still is. But technology is allowing us to cut certain processes out of it. The individual artist is still involved. I see the technology picking up some parts of it and let them focus on the more artistic stuff on the final product.
If you have an issue with your mouth, go and see your dentist and talk to them about it. I think you'll be shocked with the way the technology is today and that they have options that you never would have dreamed. And anything that you really want, you can get.